Hi guys, my name's Santara Lee and I've decided to do this video as my first YouTube video because I'm going for shoulder surgery next Tuesday. And when I first found out that I was going to have shoulder surgery, I started Googling and YouTubing to find more information about the kind of surgery I was having and to see if I could find out more about it. Basically, all I could come up with really were information, videos on YouTube about rotator cuff injuries. Now, I'm going for an operation known as arthroscopic subacromial decompression and long head of bicep tenodesis. So in layman's terms, that means my right clavicle's got bone spurs or bony growths that need to be cut off, and my long bicep in my right arm needs to be moved lower down my arm to make it more comfortable for me to move. Now, this injury, basically, what I've been told, is a combination of impact injuries that have caused the bony growths, a little bit of arthritis. I'm 33 and I've got a family history of arthritis. So that, along with lots of sporting impact injuries to that right shoulder area and lots of falls, because I figure skate between 4 to 6 times a week and teach on Saturdays. So falling, sort of putting the arm, extending the arms out, and just that impact injury, as well as side impact injury. Now, the reason I've decided to do this video is to hopefully help somebody else, give you guys a bit of information if anyone else out there is going to have a surgery similar or the same as mine. Hopefully that'll help you out. If you guys have got any questions, leave it in the comments box at the bottom, and if there's any information that I think of later I forget to put in this video, I'll also put that in the description section down the bottom under the video. So basically, I've got everything organised at the hospital. I spoke to the anaesthetist yesterday. She gave me a call basically just outlining what she's going to be doing for me. I'm a registered nurse, so I've done ample research. I've also been in theatre in recovery and done a lot of anaesthetics work pre-op with patients, sort of with the anaesthetist speaking through to them what they're actually going to be having and sort of the effects of the anaesthetics. So I'm quite happy with everything that way. My surgeon is going to be operating out of Glengarry Hospital in Perth, Western Australia, and his name is Dr. Tao Shan Lim. He's a shoulder orthopaedic surgeon, and from what I've been told, he's one of the best in the industry. So I've got no problems with that, and hoping everything goes as planned. Pretty stock standard arthroscopic or keyhole surgery. So if there's no problems, I should have minimal scarring, hopefully 2 to 3 incision holes in the top and side and back of my shoulder. I've got my pre-op instructions here from the hospital. So basically I need to fast from midnight, bring in any relevant things, medications, you know, toiletries, all that kind of boring stuff. I've been told that I'm just going to be staying in overnight just until they manage the pain, and I should be right to go home in the morning. My biggest thing that I've found looking on YouTube videos, regardless of what kind of surgery people have had on their upper body, is sleeping in your bed is going to be near on impossible. So I have been searching for an automatic recliner, and I've managed to hire one from a disability service place here in Perth. So that'll be delivered the day before surgery, so I can have a bit of a play around with it. But what I've concluded from watching other videos is sleeping on a bed, or sleeping rather flat, even with pillows propping up and things like that, is going to be quite uncomfortable and near on impossible. I suffer I'm a light sleeper, and I also suffer from mild insomnia. So I'm going to be needing as much sleep as I can get, and depending on what sort of medications I have for pain relief post-op, things like Oxynorm, Oxycontin, things like that, they might knock me out, but I'm still probably going to have a lot of problems sleeping, getting comfortable. For about 3 weeks after the surgery, I'm going to be having my arm immobilized in a block sling, so I'm not going to be able to even sort of move my arm to reposition myself. So I thought a recliner was probably the best way to go. It'll also help me sit up out of the chair without actually using that side of my shoulder. I'm not going to want to activate any of the muscles in there, I've been told. Otherwise it's going to be, number one, quite painful, and number two, it can actually end up tearing that long bicep actually off its point again. Now I'm flying out to London 5 weeks post-op, which my surgeon said should be all right as long as I follow all my post-op orders and I can get the pain under control and everything like that. So I don't want to be tearing that bicep off again and having to go under it again. Now, I've got a little list here of things I want to go through with you guys. I think I've pretty much covered everything. Basically, my thoughts on the surgery are everything should be routine. It's just arthroscopic keyhole surgery. 1 night stay in hospital and come home the next day. I've got lots of help. My mum's taking a week off work and my husband will be helping out. I'm going to train the little kids to be little minions and they can help grab me stuff. But I'm hoping after the first week, once I've got used to sort of not relying on that shoulder and that arm, I can start pottering around the house and everything. Been told I'm not allowed to drive for at least 3 weeks while I've got that sling on, so that's going to be an absolute pain. I'm going to be pretty much housebound unless people want to come and taxi me around. So done the usual, download lots of videos and things like that, and got music on my iPod, taped lots of things off Foxtel, keep me amused. So I'm hoping to just use that time to rest up and just sort of chill out and be a bum for a while, which I'm not used to doing. So my aim with the videos is, obviously this one's 1 week before. I'm hoping to do the day before surgery, the day of surgery. If I'm able to do one on my iPhone or iPad when I come out of recovery, if I'm up for it. Otherwise it'll be sort of as soon as I can after I come out. And then I'll do a series of recovery videos. So hopefully every day or every second or third day for that first week or two. And then I'll do some follow-up ones as when I start rehab on that arm, because from what I've seen on YouTube videos, rehab is excruciatingly painful after not using that arm for quite a long time, and then you have to start moving it again. So I'll let you know how I go with that, and just sort of generally posting videos. Like I said before, if you guys have got any questions or anything, if I've forgotten anything, it'll all be underneath the video. So see you guys next week. Bye.